It is very important to know that consuming certain types of fruits on a regular basis may significantly improve your body's insulin response by as much as 48%, particularly for individuals who are in their 60s or beyond. This number is not arbitrary. It is derived from a specific analysis. This information is derived from a comprehensive multi-year study featured in the Journal of the American College of Cardiology. The unsettling aspect: numerous older adults believe they are opting for healthy options, yet certain widely used fruits in their kitchens can insidiously elevate blood sugar, provoke inflammation, obstruct blood vessels, and potentially exacerbate cognitive decline. There is a specific fruit, which we will disclose later, has been associated with increased levels of a harmful compound that can build up over time and potentially harm your liver, kidneys, and cognitive function if ingested regularly. Indeed, the very fruit frequently suggested for low-sugar diets may be causing lasting damage to aging bodies, and it's likely sitting in your snack jar at this moment. Rest assured, as this video will provide a comprehensive breakdown of everything you need to know. This comprehensive guide covers the most beneficial fruits for blood sugar control and cognitive function that you should incorporate into your diet, as well as those you should eliminate without delay. Be sure to stay tuned until the conclusion, as the top entry on the negative list harbors a concealed truth that is rarely discussed, and it may be significantly impacting your health without your awareness. Before we dive in, please share in the comments where you're tuning in from. Also, remember to give this video a thumbs up and subscribe to our channel for more content like this. Fifth on the list, strawberries. Strawberries stand out as a remarkable source for enhancing insulin sensitivity. Strawberries are an exceptional food choice for those in their later years, primarily due to their impressive levels of polyphenols and fiber, which together play a crucial role in preserving healthy blood sugar levels. With advancing age, the natural process leads to increased resistance to insulin and fragility of our metabolic system, resulting in a heightened risk of blood sugar spikes that can pose significant dangers. A mere quarter cup of strawberries each day delivers approximately 3 grams of fiber, playing a crucial role in mitigating the natural sugar absorption that tends to accelerate post-age 65. The unique quality of strawberries lies not only in their fiber content, but also in the way they deliver anthocyanins, an antioxidant that is often lacking in the diets of many seniors. This form of antioxidant serves as an essential transport mechanism, ensuring that glucose effectively reaches the cells for energy instead of accumulating in the bloodstream, where it may lead to harmful consequences. The ellagic acid found in strawberries plays a crucial role in promoting cellular health by aiding in the reduction of oxidative stress. This aspect becomes particularly significant as the risk of cardiovascular issues escalates with advancing age. It is advisable for seniors to include approximately 10 to 15 strawberries in their daily diet, ideally in their fresh or frozen form without any added sugar. The vitamin C content in strawberries, approximately 97 milligrams per serving, plays a significant role in alleviating inflammation, a prevalent issue impacting nearly 40% of older adults. Notably, research from Tufts University indicates that the distinct antioxidant profile found in strawberries plays a significant role in safeguarding pancreatic cells against oxidative damage, which may help mitigate the diabetic decline that often concerns individuals as they grow older. When selecting strawberries, prioritize those that retain their vibrant red color, as the color is rich in flavonoids that synergize with vitamin C to enhance antioxidant effectiveness. It is essential to wash strawberries thoroughly, as they may present a pesticide risk for seniors with compromised immune systems. Fourthly, we have blueberries. Renowned for their cognitive-enhancing properties, blueberries stand out as a remarkable source of nutrition for seniors, and it's interesting to note their physical resemblance to the brain, the very organ they support and safeguard. These exceptional fruits boast the highest concentration of flavonoids found in any common berry, a noteworthy antioxidant that combats inflammation. This is of great significance for aging brains, as inflammation plays a crucial role in preserving the integrity of brain cell membranes and enhancing neurotransmission. A significant study published in the Journal of Nutrition revealed that older adults who incorporated 1.5 ounces of blueberries into their daily diet for 8 weeks experienced notable enhancements in cognitive processing speed and mental flexibility. The distinct polyphenolic compounds found in blueberries have the ability to traverse the blood-brain barrier, directly combating inflammation within neural tissues. This mechanism may play a role in decelerating the advancement of conditions such as Alzheimer's and dementia. It is often overlooked that blueberries are a source of melatonin, a hormone that tends to diminish with age, leading to the sleep issues frequently encountered by older adults. Incorporating a small handful of blueberries into your evening routine can significantly enhance the regulation of your sleep-wake cycle. Blueberries offer significant cardiovascular advantages due to their unique blend of arginine, an amino acid that enhances blood vessel function, and polyphenols that help mitigate oxidative stress. For seniors on blood pressure medications, incorporating blueberries into their diet can effectively support these treatments by promoting arterial flexibility. For optimal benefits, it is advisable to refrigerate blueberries to safeguard their delicate compounds from oxidation, and it is recommended to consume approximately 7 to 9 blueberry handfuls each day. We recommend blending them in a smoothie whenever feasible, as this activity serves as a gentle way to absorb their nutrients. The subtle tartness found in blueberries serves as an indicator of their robust antioxidant properties, so there's no need to shy away from this naturally protective flavor. Thirdly, we have avocados. Avocados serve as an effective regulator of blood sugar. Avocados are often overlooked in discussions about senior health, especially regarding their role in supporting healthy blood sugar levels. Avocados are distinguished by their remarkable potassium to carbohydrate ratio, offering approximately 975 milligrams of potassium per serving and maintaining a naturally low sugar content. This balance of minerals is especially important for older adults, as it can help mitigate the sugar retention that often occurs with aging kidneys. This adjustment may lead to a reduction in fasting blood sugar by 3 to 5 points, an effect similar to that of certain prescription medications, but without the associated side effects. The presence of lutein and zeaxanthin in avocados is noteworthy, as these carotenoids are known to specifically benefit the macula of the eye. This protection is crucial in combating age-related macular degeneration, the primary cause of vision loss in individuals over the age of 60. Avocados offer a uniquely soft, creamy texture that is gentle on aging teeth and gums, making them a preferable choice compared to harder foods that may present dental challenges for seniors. Their unique green and purple colors are not merely attractive, they indicate the presence of antioxidants that play a crucial role in neutralizing free radicals, which contribute to the aging process in the body. Avocados offer a practical benefit that is particularly advantageous for seniors. Adding them to meals inherently reduces consumption, helping to prevent overeating while offering a mindful eating experience that can be both meditative and beneficial for cognitive function. A study featured in the International Journal of Obesity indicates that the presence of healthy fats in avocados acts as a visual cue for satiety, aiding seniors in more effectively managing their intake. Individuals experiencing arthritis in their hands should consider selecting avocados that are partially open. This choice facilitates easier access while still allowing for the advantages associated with the fruit. It is advisable to consume approximately half an avocado each day, which equates to 1 ounce, with a preference for unsalted or lightly salted options. The fiber content in avocados, approximately 7 grams per ounce, plays a crucial role in regulating blood sugar levels. This is especially significant for the 25% of Americans aged 65 and older who are affected by diabetes or prediabetes. Second on the list, apples. Apples hold the highest rank on our list due to their significant role in supporting a crucial, yet frequently neglected aspect of senior health, metabolic function. These exceptional fruits stand out as the most abundant food source of soluble fiber, with a single apple providing 4.5 grams, equating to 15% of the daily requirement. The significance of this issue cannot be overstated, as thyroid disorders impact nearly 20% of individuals over the age of 65, with a considerable number of cases remaining undiagnosed due to symptoms frequently being misinterpreted as a natural part of aging. The pectin found in apples plays a crucial role in the conversion of food into energy, thereby directly supporting metabolic function and mood regulation. In addition to their role in supporting metabolic health, apples are rich in distinctive fatty acids that contribute to the maintenance of pectin, the protective sheath surrounding nerve cells, which often deteriorates as we age. The preservation of pectin is likely to enhance coordination, reaction time, and cognitive processing speed in seniors. Apples are particularly intriguing due to their provision of organically bound fiber, which is more bioavailable than synthetic fiber supplements. This means that your body can utilize it more effectively. The rich, crunchy texture of apples renders them quite satisfying, even in modest portions, which is crucial given that their potency allows for significant benefits with just a small quantity. It is advisable for seniors to restrict their intake to 1 or 2 apples per day, as an overabundance of fiber can be detrimental. Opt for apples that are still encased in their skin whenever feasible, as this natural barrier aids in maintaining their nutrient integrity for an extended period. It is advisable to keep them in the refrigerator to avoid the risk of their high sugar content becoming rancid. For seniors experiencing constipation, apples provide valuable advantages due to their unique blend of fiber and natural water that support bowel regularity. Their inherently sweet and tangy taste positions them as a superior alternative to less nutritious snacks that often appeal to seniors seeking comfort. Notably, recent studies indicate that the unique antioxidants found in apples could play a role in safeguarding telomeres, the protective caps on chromosomes that generally diminish with age, thereby potentially affecting our aging process at the cellular level. These fruits are highly recommended for consumption after the age of 65. First and foremost, cherries. Cherries have emerged as a significant concern for seniors, presenting various serious issues that directly affect older adults. It is particularly concerning that these compounds have the potential to interact with more than 60% of medications frequently prescribed to seniors, which could lead to diminished drug effectiveness or the emergence of hazardous side effects. The interactions are notably significant with blood pressure medications, statins, and specific antidepressants, which are commonly prescribed to individuals over the age of 65. The significant concern lies in the fact that many healthcare professionals, including physicians and pharmacists, often fail to inform patients about this critical food-drug interaction. One of the more troubling issues is cherry syndrome, a condition in which the consumption of cherries leads to a lingering, bitter metallic taste that may persist for weeks. Although this may appear to be a minor inconvenience for seniors, it can have serious consequences, as alterations in taste frequently result in diminished appetite and a decline in nutritional health. Research indicates that as many as 42% of those impacted undergo considerable weight loss as a consequence. The syndrome seems to impact older adults more significantly, likely as a result of age-related alterations in taste receptors and detoxification mechanisms. Cherries are known to have elevated levels of anthocyanins that can oxidize rapidly, leading to the formation of harmful compounds. These compounds may exacerbate inflammation in the body, posing challenges for seniors who are already dealing with inflammatory conditions such as arthritis. The diminutive size and slick texture present a notable aspiration risk, particularly for older adults who experience swallowing difficulties or those on medications that induce dry mouth, a condition prevalent in over 70% of seniors managing multiple prescriptions. Cherries possess enzyme inhibitors that may disrupt protein digestion during a life stage, characterized by a natural decline in protein absorption efficiency. In a pie, which is one of their most prevalent culinary uses, the elevated sugar content paired with cherries results in a calorie-rich food that may pose challenges for weight management, particularly for individuals over the age of 65. Emerging studies indicate that compounds found in specific varieties of cherries may contribute to the acceleration of age-related macular degeneration, a condition recognized as the primary cause of vision loss among seniors. These are the 5 fruits you may want to steer clear of after the age of 65. Now let's discuss fruits that older adults should consider limiting or approaching with care. Fifth on the list, we have peaches, recognized as a potential inflammatory trigger. While widely enjoyed, peaches present various risks that can be concerning for numerous seniors. Initially, it is crucial to recognize that peaches are not genuine berries. Rather, they are stone fruits that develop on trees. This unique growth environment renders them especially vulnerable to mold and aflatoxins, naturally occurring mycotoxins generated by specific molds. These substances can harm the liver and potentially elevate cancer risk with regular consumption. The likelihood of this risk escalates with advancing age as the body's natural detoxification mechanisms tend to diminish in efficiency. It is particularly alarming for seniors that peaches possess proteins capable of inducing inflammatory responses in numerous individuals, even in the absence of a genuine allergy. This mild inflammation can worsen joint discomfort, heighten cardiovascular strain, and potentially speed up cognitive deterioration, all of which are 3 aspects already at risk in older adults. The elevated levels of fructose found in peaches exacerbate this issue, given that the average American diet already includes an excessive amount of sugars compared to the beneficial fiber that helps combat inflammation. For seniors on blood thinners, such as warfarin, the presence of vitamin K in peaches poses a risk of interfering with the medication's effectiveness, an important interaction that is often overlooked by healthcare professionals. Many commercial canned peaches exacerbate these concerns by incorporating hydrogenated oils, excessive sodium, and sugars, which can place additional strain on aging cardiovascular systems. Natural peach preserves often include added sugar, which can contribute to elevated blood sugar, a significant issue for the 63% of American seniors affected by hypertension. Storage issues pose a significant challenge as peaches that are not stored correctly can become rancid, leading to the formation of harmful free radicals. The standard canning method employed for the majority of commercial peaches results in the formation of acrylamide, a compound that studies indicate could potentially hasten cognitive decline, raising particular concerns for individuals already apprehensive about memory impairment. For those who have been consuming peaches without noticeable problems, making a shift to one of our suggested fruits for even 3 days a week can enhance your nutritional intake and minimize exposure to certain undesirable compounds. Thirdly, grapes can lead to unexpected sugar spikes. Grapes pose a notable issue for older adults due to their unexpectedly elevated carbohydrate levels and significant glycemic effects. In contrast to genuine berries, grapes have a notably higher carbohydrate content, approximately 16 grams per ounce, and a lower amount of fiber protective compounds. The blood sugar response generated by this can pose significant challenges for the approximately 25% of adults over 65 diagnosed with diabetes, along with the further 48% who are classified as pre-diabetic. The situation is particularly concerning because grapes are often perceived as a healthful choice, which may lead many seniors to indulge in them without understanding the potential impact on their glucose levels. The curved and smooth shape of grapes contributes to their status as one of the most frequently aspirated fruits among seniors, posing a significant choking hazard that must be taken seriously, especially for individuals with swallowing difficulties. From a nutritional perspective, grapes are notable for their high sugar content, compounds that can bind to calcium in the digestive system, thereby diminishing calcium absorption. This poses a considerable concern for seniors who are already at risk for osteoporosis. Sugar can significantly contribute to the formation of kidney stones in individuals who are predisposed, with the risk notably rising after the age of 60. The processing involved in grape production reveals an additional underlying challenge. Grapes require significant processing to eliminate contaminants. This processing typically involves high temperatures, which can compromise their nutritional value. Many commercial varieties undergo drying and are heavily sugared, which introduces unhealthy fats and sodium that can raise blood pressure and put additional strain on the cardiovascular system. It is important to note that grapes possess enzyme inhibitors that may hinder protein digestion. This can pose significant challenges for seniors who frequently experience diminished digestive efficiency and difficulties with protein absorption. The rich, sweet texture of grapes enhances their appeal, but it also increases the likelihood of overconsumption, which may lead to weight gain during a life stage, when managing a healthy weight becomes more difficult for those who have been consistently incorporating grapes into their diet. It may be beneficial to transition to strawberries or blueberries. These alternatives offer superior nutritional benefits and pose fewer risks, particularly for aging individuals. Second, bananas, though undeniably tasty, pose significant challenges for seniors, largely because of their remarkable caloric density. With around 105 calories per banana, these fruits stand out as a calorie-dense option on the market. This issue becomes particularly alarming as metabolic rates inherently decrease with age, rendering weight management more difficult for older adults. Their notably elevated sugar content, approximately 14 grams per banana, imposes further demands on insulin function, which generally tends to decline in efficiency with age. For the estimated 15% of seniors with asymptomatic diabetes, the consumption of bananas can provoke painful episodes that may otherwise stay inactive. In addition to their caloric content, bananas are notable for having one of the highest levels of sugar among fruits, with approximately 14 grams per serving. This can lead to increased blood sugar levels, a significant concern for many older adults. Their hardness and density pose considerable dental risks for older adults with crowns, bridges, or compromised teeth, particularly after the age of 65, when prolonged wear and diminished calcium absorption can weaken dental integrity. From a practical perspective, bananas rank as some of the most common fruits, which may prompt budget-conscious seniors to opt for lower-quality alternatives that could be rancid or inadequately stored, thereby heightening the risk of exposure to harmful oxidized sugars. Bananas found in the market are frequently subjected to excessive ripening and heat, which introduces unwarranted sugar and compromised fats to a nutritional profile that is already concerning. Their rich, buttery flavor can lead to overconsumption, particularly among seniors who might experience reduced taste sensitivity and thus gravitate towards more intense flavors. It is quite alarming that numerous seniors opt for bananas under the impression that they are making a beneficial choice for heart health, unaware that the research advocating for fruit consumption in relation to cardiovascular health has specifically excluded or restricted high-sugar varieties such as bananas. If you have been incorporating bananas into your diet, it may be beneficial to shift towards avocados. They offer a comparable enjoyment while boasting a more advantageous nutritional profile, particularly for those in the aging demographic. Dried apricots are a remarkable ingredient. Dried apricots have emerged as a significant concern for seniors, presenting various serious issues that directly affect older adults. It is particularly concerning that these compounds have the potential to interact with more than 60% of medications frequently prescribed to seniors, which could lead to diminished drug effectiveness or the emergence of hazardous side effects. The interactions are notably significant with blood pressure medications, statins, and specific antidepressants, which are commonly prescribed to individuals over the age of 65. The significant concern lies in the fact that many healthcare professionals, including physicians and pharmacists, often fail to inform patients about this critical food-drug interaction. One of the more troubling issues is dried apricot syndrome, a condition in which the consumption of dried apricots leads to a lingering, bitter metallic taste that may persist for weeks. Although this may appear to be a minor inconvenience for seniors, it can have serious consequences, as alterations in taste frequently result in diminished appetite and a decline in nutritional health. Research indicates that as many as 42% of those impacted undergo considerable weight loss as a consequence. The syndrome seems to impact older adults more significantly, likely as a result of age-related alterations in taste receptors and detoxification mechanisms. Dried apricots are known to have elevated levels of sugar that can oxidize rapidly, leading to the formation of harmful compounds. These compounds may exacerbate inflammation in the body, posing challenges for seniors who are already dealing with inflammatory conditions such as arthritis. The diminutive size and slick texture present a notable aspiration risk, particularly for older adults who experience swallowing difficulties or those on medications that induce dry mouth, a condition prevalent in over 70% of seniors managing multiple prescriptions. Dried apricots possess enzyme inhibitors that may disrupt protein digestion during a life stage characterized by a natural decline in protein absorption efficiency. In a fruitcake, which is one of their most prevalent culinary uses, the elevated sugar content paired with dried apricots results in a calorie-rich food that may pose challenges for weight management, particularly for individuals over the age of 65. Emerging studies indicate that compounds found in specific varieties of dried apricots may contribute to the acceleration of age-related macular degeneration, a condition recognized as the primary cause of vision loss among seniors. These are the 4 fruits you may want to steer clear of after the age of 65. Making informed choices about the fruits you incorporate into your daily diet can greatly influence your health, energy levels, and cognitive function as you age. Ultimately, it's important to recognize that even minor adjustments, when implemented consistently, can lead to extraordinary outcomes over time. We invite your insights and perspectives. Have you observed any positive or negative shifts in your health after incorporating or eliminating specific fruits from your diet? Which fruit had the most significant impact on your experience? We invite you to share your insights and experiences in the comments below. Your contributions are highly valued. I appreciate your viewership.